Good morning, friends. Dr. Larry Mitnaul, your friendly neighborhood child and adult psychiatrist. So there's an interesting paper out there in the American Academy of Pediatrics looking at the relationship between opioid use and suicide risk behaviors. Now, obviously, my bias is for helping kids with their mental wellness, and so this is kind of an important issue. This study looks particularly at high school students, and it has some very interesting findings that we'll talk about here. But before we get to that, I wanted to make you aware that the data analyzed in the study comes from something called the YRBS, or the YRBSS, which stands for the Youth Risk Behavior Surveillance System. In short, the YRBSS is a collection of national school-based surveys conducted with collaboration from many entities. So the CDC, state territories, tribal localities, education systems, and health agencies. And so what's really cool about this interesting tool is that it can be used to get a view of kind of national trends in behavior and experiences among U.S. high school students. And so have you ever wondered where some of the statistics come from about youth and current practices? That's right, part of the secret is being revealed here. So now you have access to what those things look like. So what does it track? Well, it monitors 6 main categories of health-associated activities, including activities that lead to accidental injury or violence, sexual behavior, so think pregnancy or sexually transmitted infections like HIV, alcohol and substance use, tobacco usage, unhealthy dieting, and lack of physical exercise. And so the YRBSS has collected data from more than 4.9 million high school students between 1991 and 2019, which is pretty impressive. So back to the study I mentioned. So the study looked at the habits of teens who are misusing prescribed opioids. And they wanted to know if there was a difference in teens thinking about suicide, which we might call ideation. So the thinking about one's life being over, planning or engaging in suicidal behavior. So those were the things they were looking at. So what did the study find? Well, current or past opioid prescription misuse was certainly associated with suicide risk behaviors compared to those with no history of misusing these substances. Active or current use was the highest risk group. This group was also more likely to report feeling really sad and hopeless. And so what did they conclude from this study? The study authors actually ended with a hopeful note, that addressing the problem of substance use comprehensively is an encouraging path forward to tackling this problem in public health and also helping our kids maybe get some of the mental health and wellness that they need. So what's the psychiatric lens on all of this and the use of substances and mood in our children? So some of the psychiatric takeaways from this for me are as follows. It's important for us to be aware and identify our kids and adults for that matter who may be struggling with addiction and misuse of opioids and other substances too, because it is a significant risk factor in our child's mental wellness and well-being. And so discovering that a child may be using opioids should also encourage us to think and ask the question, what else is going on for them? How can we address the needs that follow along with those things or might be fueling or leading to use? So here's my action step for you today. Check out the links below for one of my favorite reputable resources for materials on substance abuse, including links to programs and training for those interested in broadening their own skill set to be able to recognize it in their own families, in their own communities, or in the work that they do. All right, my friends, I always appreciate your time with me. Hopefully you've gotten something out of it. Take very good care and be well.